You're very welcome to Woman Show here on Confident Women Ireland's YouTube channel with me, Roisin. On this episode, we are talking about breast cancer and menopause. And to discuss these issues with me is retired breast surgeon Dr. Liz O Riordan, an author of A Complete Guide to Breast Cancer, which was published in 2018. Dr. Riordan herself has had breast cancer twice, so this is a subject very close to the Dr. Riordan's heart. And joining us, hopefully a little bit later on, will be Breeda Birmingham, menopause coach and author. Many of you will be familiar with Breeda's work and the work that she published, Ireland's first research menopause book here in Ireland. Dr. O'Riordan, you are very, very welcome to the Confident Women Ireland's YouTube channel.
Thanks for having me, Roisin.
Dr. O'Riordan, breast cancer is a major worry for many, many women, and especially during their midlife and the transition between perimenopause, menopause, and menopause, when we become a lot more aware of breast health with our regular breast checks and mammograms, through our menopause health. But first of all, let's the audience get to have a little gist of who you are. Dr. Roisin, I started following you on Twitter, and you have an amazing Twitter page. You're also on YouTube with an amazing and really brilliant YouTube channel. You also have podcasts. You're an author of a book called just A Complete Guide to Breast Cancer. And you're based in Suffolk in England.
That's right.
So, Dr. Roisin, first of all, you are a breast surgeon and you actually also were given the diagnosis of breast cancer twice in your life. So that must have been an awful shock. A breast surgeon receiving the news who you operate on many women who you're actually helping women who have breast cancer and then you're given that diagnosis.
Yeah. It was really hard. I was 40, I was fit, I was a triathlete. I never checked my breasts because it was never going to happen to me. Even though I treated women with breast cancer, I never checked my own breasts. And one day I noticed a lump and I thought it was a breast cyst because I'd had several breast cysts. I'd had a normal mammogram the year before. And it was my mum who said, look, will you get it checked out again? Because it's a cyst, it's fine. I've got expert hands. I should know what a breast cancer feels like. And it was a large cancer. And it was really weird. It was like a light bulb going off because I knew too much. I was going to have chemotherapy, mastectomy, reconstruction, radiotherapy, all the treatments that my patients had, and my brain couldn't cope. And I kind of went into denial to protect me from everything I went through. And that was good 9 or 10 months of treatment. And I went back to work briefly, but that was really, really hard because I wanted to hug patients and say, yes, this is terrible and I get it, but I had to be the bad guy. And it was really, really ethically hard working out what you do when you've had the illness your patients have. And then 2.5 years later, I had an awful lot of painful scar tissue on my chest wall, and my implant with radiotherapy had become like a shrunken, painful tennis ball. I was planning to get rid of it. And my surgeon said, let's just ultrasound this scar tissue. And that was a 2.5 centimeter recurrence on my chest wall, which led to more surgery. It meant I couldn't operate anymore because my left arm didn't move properly. And I had to retire at the age of 43. And I was suddenly left thinking, what do I do with myself? Because I've spent 20 years working myself to the bone to become a breast surgeon.
My goodness. Breeda, you're very welcome. Breeda has just joined us.
Hi, Breeda.
Dr. Riordan, if I can introduce you to Breeda, and
Hi, Liz.
Dr. Riordan.
Hi.
Hi, Liz. How are you? I'm a big fan of your water swimming, your cold water swimming.
It's bonkers, but I love it. I actually broke the ice properly yesterday, so that's a tick off.
Wow. Liz, if you don't mind, I'd love to ask you, because I meet a lot of women who have survived, let's say, breast cancer, and I'm sorry now I didn't get to hear the start of your conversation, but if there were any tips you could share around, managing menopause, let's say your top 3 tips for managing those menopausal symptoms that come on quite suddenly once you arrive into the menopausal stage of the, after surgery.
That's a huge topic, but I'll do what I can. As a breast surgeon, I didn't get how bad the symptoms of the menopause could be with the tablets I was prescribing. I had no treatment in it, no training. I assumed the GPs would figure it all out. You have a few hot flashes and maybe a bit of vaginal dryness, off you go. And then at 40, I went into an instant chemical menopause and I got it. And it is really hard, especially when you're young, because you are having an extra 10, 20 years of menopausal symptoms before you get to your 50s. I think one thing to remember is often it's the people who suffer the most shout the loudest. So often on social media, you are seeing the people who are really struggling, and not most women who have a bit of a tough time for a couple of years and then it settles down, because the internet's a really funny space. The first thing to say is it's the really boring things like exercising and eating well and sleeping that can naturally help with all the symptoms you get with a menopause. No one wants to hear them. You want a magic cure, but actually they can really help. There are now a whole host of drugs that can be prescribed to help with the hot flushes and the symptoms. I didn't know about them. A lot of GPs don't know, but the British Menopausal Society has a great list of things you can go to your doctor and say, what can you give me instead of HRT? The big thing I would really recommend for women's intimate health that we don't talk about, but I spent lockdown talking about sex after breast cancer, is using a good lubricant, something like Yes or Sutil, with no parabens, no glycerin that won't cause thrush. We should be telling girls of the age of 16 or 18, this will make sex fun. You should be using it. It's great. It's not what I thought it was what prostitutes use. You know, lubricant, it's dirty. It's not, it's great. And vaginal estrogen is safe for women taking tamoxifen, and it's probably safe for women taking an aromatase inhibitor. And that tiny bit of local vaginal estrogen can have a massive impact, not just on your sex life, but for water infections. And for me as a cyclist, I was getting labial skin tears on a bike ride for more than an hour, and I'm used to doing 4 or 5 hours in the saddle. So I think there is so much we can do to help. It's not the end of the world.
And the urinary tract infections, you know, so many women you know, that they're going back to their GP again and again, and a lot of the time, once they start the vaginal estrogen, it's like a magic happens.
Yes.
You know, but the joy of the internet and having social media is that women can actually become informed. Okay, you know, there's an awful lot of information out there, so you have to be careful around, you know, navigating it. But I think it's wonderful, even compared to 4 years ago when I started kind of working and talking in the space here in Ireland. Very few people were actually talking about menopause, but I found great camaraderie from others on social media. And it's all about women helping and supporting other women, I think, at the end of the day. That's the big bonus to this.
It is, isn't it? Completely.
Yeah.
So, what is, would you say then, we'll talk more again about menopause in a little moment, and Breeda, you just pop in, we'll make this a nice conversation between 3 women, between 2 experts and 2 medical expert backgrounds as well. But so what would you say would be what the top signs of breast cancer, and who is more prone to breast cancer?
Okay, so breast cancer commonly affects women from their mid-40s upwards. Your biggest risk factors of getting it are being a woman, so having breast tissue, and being older. It's your lifetime exposure to various hormones and things. Young girls do get breast cancer, and it seems really common because they are often on social media blogging. And the way we pick it up is through screening for most women. So you're called for your screening mammograms from the age of 50. And that's because mammograms work by looking for a white cancer on a black background. And after the menopause, your breasts become more fatty rather than dense hormonal breast tissue. So on a black background, you can see a white cancer. When you're young and you're having regular estrogen and progesterone, your breasts are dense and very white. So you can't see a tiny white cancer on a white background.
Right.
So the most important, and I've done a video on this to show you how to examine your breasts. The most important thing you can do is to check your breasts every month in the middle of your cycle if you're premenopausal, because that's when your breasts are less lumpy. And you look in the mirror to look for any skin changes. Has the nipple been pulled in? You lift your arms above your head to see if there are any dimples. You then lie back at about 30 degrees in a bed or a bath and use the flat of your hand to feel your breasts, looking for lumps and comparing the other side. And you can link to a video I've done that shows you exactly how to do it and what to feel. You know your breasts best. but you
I'll
have to
put
check
that
them
link in.
regularly.
Yeah, I'll put that link in the description box.
Other signs and symptoms can be bleeding from the nipple. So if you notice when you take your clothes off or your nightie at the end of the day, there's a bit of blood on the nipple, that could be a sign of cancer. You can also get skin changes and rashes around the breast. But there are, again, lots of breast cancer charities will have all the symptoms of breast cancer. But it's funny, for a lot of women, a bit like me, I swear the lump I saw wasn't there the day before. They can just appear overnight. Most women have only noticed a lump for a week or two before they see a breast cancer surgeon. And I describe it a bit like pregnancy. Breast cancers can take years and years to grow, but they double in size. And one day, like a pregnant woman will suddenly show, where did that bump come from overnight? The tiny cancer has just grown big enough to see or feel.
Wow.
But I would
Liz,
say,
could I just ask you about let's say the genetics then, the
yes,
genes?
Yeah.
If that's the case.
So there are the two common genes that can cause breast cancer are BRCA, BRCA1 or 2. But there are other genes like a check mutation and a PAL mutation, which are very scary. They only account for about 5% of all breast cancers that we know of. If you only have one person in your family with breast cancer, and it was a first degree relative, so a mum or a sister, and they were diagnosed over the age of 40, you are not at any increased risk. Good. It's only when there are 2 or 3 members on your mother or your father's side that were diagnosed at a young age, 30, 40, 50, that there may be the possibility of a gene in the family, but it only accounts for a small proportion of breast cancers. And I'd like to say the whole point of screening is to pick up breast cancers at a tiny stage before their lumps are big enough to feel. And that means a lot of women don't need to have mastectomies and don't need chemotherapy, but you can still develop breast cancer in your 70s, 80s, and 90s. And in England, I know you can self-refer for mammograms every 3 years after the age of 70, just in case something does grow.
Okay, yeah, we have breast screening here in Ireland as well. Liz, the other question I suppose that I'd love to ask you is around the HRT and the controversy around breast cancer and HRT. Can we take it? Can we not take it? What's your opinion, if you don't mind me asking?
This is controversial. There is no good evidence to prove whether HRT is 100% safe or not. A lot of the studies were done looking from women from the 50s, 60s, 70s, 80s. They were small studies. A lot of data wasn't recorded. The 2 newest studies that have been done show that HRT can increase your risk of recurrence and therefore death after breast cancer. There are a group of doctors who don't believe those studies, but I'm with a group of doctors who do. I do believe that the treatment for breast cancer for many women is to stop them producing estrogen. And if you are giving them HRT, you are giving them additional estrogen, and it can increase that risk of recurrence. Now, I know that some women have severe menopausal symptoms, especially mental problems. You can get really, really severe depression. And I think if you have tried every other treatment, the non-HRT treatments, the complementary therapies, and you are still struggling, and you know that HRT could make your breast cancer come back, but you are prepared to take that risk, you are fully aware, and if it does come back, you can cope with the guilt or blame, then it should be a woman's choice. But I don't think that message is getting across that HRT could make your cancer come back and therefore kill you before your time. Does that make sense? I think it should be a woman's choice. Yeah. Who are we to say? Yes. We don't tell women, no, you can't have alcohol, when that can increase the risk of breast cancer. We don't tell women, you know, I'm not going to treat you unless you exercise 5 times a week, because that can halve your risk of recurrence. But we withhold a drug that might improve their quality of life. And we as doctors are not living with the symptoms that woman has. But they do need to know about the risks. And if it does come back, can they cope with the thought that it might be their fault? And they may say, yes, that's fine, but my life is miserable. And we know a lot of women don't take their tamoxifen regularly because it makes them feel awful, which is why getting the information about the alternative painkillers and antidepressants that can treat the symptoms without hormones has to be more widespread. What do you think about it, Breeda? About HRT after breast cancer?
Yeah, again, you see, it's controversial. I'm looking at the studies there, and I think what's very promising is the new drug that's going to come on stream this year. You know, it's a neurokinin inhibitor that women that are estrogen positive will be able to take, which is brilliant. Imperial College, I think, isn't it, in London? That research coming from there. And I mean, what you're talking about there, Liz, we won't have the answers to that for another 5 to 10 years, whether or not the HRT is going to be causing, if there is a correlation. Am I correct in saying that?
I don't think we will ever get a study. So to prove that it is just HRT alone that is causing a large amount of women for their breast cancer to come back quicker, you need to get a large group of women with the only difference between them being HRT. Same diet, exercise, alcohol. I don't think we're ever going to get that study, but the small potential studies that were done did show it does seem to increase that trend. And to me, when I'm giving women treatments to stop them producing estrogen, why are we giving them additional estrogen, especially when there are other alternatives? And yes, it can be hard for many women. A lot of women struggle through the menopause, but many women don't. And I think this is fear of people who are saying, celebrities, my menopause is terrible. You're going to, and another thing that really annoys me, people are using HRT to stop you getting other illnesses. If you don't take HRT, you'll get dementia or Alzheimer's, or you'll die of osteoporosis. It's not licensed to stop you getting other diseases. There is no proof that it can actually stop you at the moment getting dementia. But I get thousands of women with breast cancer saying, I am terrified because this influencer said, if I don't have HRT, I'm going to get osteoporosis and dementia. What am I meant to do? And it's how you counteract that message, which is terrifying for women like me who don't want to take it, who are now scared for their life.
Liz, I suppose where I come from as well, my background psychology, sociology, as well as I was midwife years ago, but I'm looking at the story. And as you just mentioned there around, there's a huge percentage of women that do not have debilitating symptoms, but the menopause has been framed around this deficiency disease, this degeneration. And so I'm looking at story, and this is where I'm moving to 2023. It's this story that we've had no agency around managing menopause. That's been part of the problem, the way it's been framed. And that needs to be looked at. And that's something I'm looking at in 2023, is like shifting the story. And I was just wondering, have you any statistics around chemical induced, let's say surgical or medical menopause? What are the statistics of women? Like, we've none in Ireland. I've looked to see, like, we've 1% under 40 that reach menopause, but the amount of, let's say, the percentage of women that undergo surgical or medical menopause, have you any approximations in the UK what those stats are?
I don't know what the numbers are. I know when it comes to chemotherapy, which can induce a chemical menopause, the younger you are, the more likely you will get your ovaries working back afterwards. The closer to 40 you are more likely to become fully menopausal afterwards. But we can give women injections to switch their ovaries off during chemotherapy. Right. There are some, so to protect them. But there are women like me who, if your cancer grows back on one drug and you're premenopausal, you need to have your ovaries out so you can go on to a different kind of drug. And I don't know how many women have it done, but there's a significant number of breast cancer patients who are put into and thing with an instant chemical or medical menopause. It's instant. You don't have the 2 or 3 years of slowly realizing, oh, this is happening. You wake up overnight and think, oh my God. And that's the really, really hard bit, because it's everything instant all at once.
And also there is such a negative narrative about menopause now within the media. It's a media narrative. And Breeda, we have many years to say, we always discuss how I've always said, for me, I went to Breeda's workshop. I was telling Liz before we came on how we met. I went down to your cafe, your very first cafe down in Waterford, walked in, saw you there as we met at a previous event. And I looked up at your PowerPoint and I counted at 35 of the menopause symptoms that was on, out of 40 was on your screen. And we were walking out of the cafe and you put your arm around me, you said, Roisin. And I kept saying, look at my legs. They're like tree trunks. I'm flooded with fluid. And you said, Roisin, it will rightify itself. Now, in this is 2023, my body is rightifying itself. But on a personal level, the menopause was the most empowering, liberating, and the time where I went through most personal healing for me as a woman, and the most creative time in my life. And I just think there's so much fear porn related with it in the media of the menopause narrative.
It's a bit like
Yes, I mean,
TripAdvisor.
95% of everything, yeah, and this 95% of everything that has been written about menopause has been negative. So there's there's a research to be done around the language and why it has been so negative over the decades in the past, and why does it need to continue this way? Because my belief is that 90%, I would imagine, looking at the stats, of women experience a natural menopause. When I say natural, not non-surgical, non-medical, not early. So of that 90%, then I'd like to, to do more research myself on how many of those, what percentage again have these debilitating symptoms. I'm guessing it's around 20-25%. And then that would leave a very large cohort of women who have, that are going through the menopause and are managing with the education, with the knowledge, and dipping into the positives, which Roisin and I, let's say we've discussed many a time, and they're in the research, these positives about access to create, a huge creative ability, more courage, more confidence, and an ability to kind of get rid of a lot of crap out of our lives. These are all the positives that I've experienced myself over the last.
Yes.
No more periods.
Yes, exactly.
No more period pain.
Yes.
Dr. Riordan, what would you say would be the most common? Where is the breast cancer? What part of the breast is the breast cancer commonly found in a woman? And is it more commonly found in the right or the left breast?
So there are many different ways of classifying breast cancer, but it either comes from the ducts, which are the tubes that take milk from the breast to the nipple. About 70 or 80% of breast cancers are in the lining of the ducts. The other 10-20% are from the lobules, which is like the meat of the breast that makes the milk. So the ducts, the lobules, and a very small portion come from the nipple themselves. Every area of the breast is equally likely to make breast cancer, but studies have shown it's more common on the left than the right, and it is more common in the upper outer quadrant, it's the bit nearest the armpit. But you can get it anywhere in the breast.
Anywhere in the breast. And, the speed.
And it doesn't matter if you have small breasts or large breasts, you're just as likely to get breast cancer. And men get breast cancer too, because they still have a little bit of breast tissue.
And that's really interesting. That's never discussed, is it, that men get breast cancer?
And it's about 1 in 350 men get breast cancer. No, I might have that stat wrong. I think 1 in 350 breast cancers are men. Sorry, that's the menopausal brain making me remember nerves. It's rare. They don't like it because breast cancer is labeled as a pink disease. And every single article and video, and I'm as guilty as myself, we say women and she, but men get it. And they feel completely isolated and ostracized. And it's really hard for them.
Yes. Yeah. Especially,
Liz, sorry, Roisin, I was just going to ask Liz, I meet a lot of women who have, when they start HRT for the first 6 months, they have huge breast changes. And then they're told, let it settle down. And I mean, again, it's all about personal choice and about whether, but I've just noticed that in a lot of the ladies I have met over the last year or so.
What are the breast changes, Breeda? What are they describing?
Bloatedness, very, very, very bloated, or as a result, like when they were breastfeeding, they describe it,
And that's because your body is getting slowly used to having less estrogen, and we're giving them a massive hit of estrogen and progesterone. So the breast is a bit like going through puberty, where you get that pre-cycle breast pain again. So suddenly their breasts are swollen, they're sore, they're tender, they're more lumpy, because the estrogen levels have just suddenly gone right back up again. And often women around their 40s and perimenopause can start getting breast pain, a bit like when they were a teenager, and it's just the body reacting to changing levels of hormones.
Okay. And when it comes to, let's say, women that want to continue on HRT, should they actually cut back on the amount they're taking?
So
Well,
I am
that
not
gives
an
you good
expert in HRT. I don't prescribe it. I cannot comment on this at all. I can't keep up to date with all the latest things. So and it depends on your personal factors, your personal circumstances.
Okay,
So
no
I
problem.
can't comment on that. I think it's up to each woman to assess what
Yeah.
her risks are and what she wants to carry on with, and should she. What I do get concerned about is women in their 70s being given HRT because their joints are a bit stiff.
Right.
That's becoming a trend of a lot of older women being given HRT in their 70s, and I can't get my head around why you would do that.
And two, you mentioned earlier on when we talked about breast cancer, you were saying about exercise. Does exercise prevent? Does it like with menopause? It eases the menopause symptoms. Does it prevent the breast cancer? No, or
So
decrease the risk.
exercise decreases the risk of you getting breast cancer. Now that means that if you take 100 women, if half of them exercise, they can halve their risk of getting it. But there are fit triathletes who still get breast cancer, but in a big group of women, it reduces the risk of you getting it. If you start exercising the day you are diagnosed, it will reduce the risk of you getting complications after your surgery and help you recover. If you exercise through chemotherapy, through treatment, it is the best cure for fatigue, for the mental side effects, for the physical side effects. And if you carry on doing aerobic and weight training, it will halve your risk of recurrence by 50%.
Brilliant.
It should be the first treatment we prescribe to everybody from the day they are diagnosed. But it's hard work. It doesn't always work. But if your cancer comes back, again, for the metastatic community, exercise can help them cope with the symptoms of their disease and the drugs.
And even just, it doesn't have to be hard hitting the treadmill,
So
or
now,
it's just movement.
the guidelines say that every cancer patient should be doing 3 half-an-hour sessions a week of aerobic exercise where your heart rate is up and you're only talking in 2 or 3 word sentences. You have to push your body hard to get the cardiovascular benefits, but you could sprint walk to a lamppost and then slow down to the next. But 3 times a week for half an hour. You should also be doing, and this is almost more important after the menopause, weight-based training. Your bone strength, your bone health, to reduce the risk of osteoporosis. It doesn't need to be in a gym. You can do squats when you get up off the toilet. You can do press-ups against the kitchen counter, little exercise snacks throughout the day, 5 times a week.
And that's a really good, that's a really good physical and mental and emotional distraction plus preventative of women's health issues.
Because most women die of heart attacks and strokes and vascular disease, and exercise can reduce the risk of that happening. Yes. And it can also help with the symptoms of the menopause. We should all be doing it, but it's boring and it's hard work. And when someone fit and healthy like me tells you to exercise, you say, yeah, but it's fine for her because she's slim. It's hard. Mm-hmm. I've not been in the gym for 2 months since my mum was ill, and I know I've got to get back to it. Life gets in the way, and it's free. You just need a pair of trainers.
Yes.
Rant over. Sorry, but it's really, really important. We need to tell women to use their bodies to get.
Yes. What I have seen as well is that, you know, this again, these are the myths around, you know, movement and you know, slowing down. Let's say a lot of my aunts would have said, you know, by the time they got to the mid 40s, 50, they're now, let's say, in their 70s and 80s, you know, they didn't bother exercising anymore. Whereas, you know, I've seen the massive benefits of continuing to, whether it's flexibility, whether it is aerobic, whether it is, you know, weight training, huge benefits to it, both personally or with many of the women. Can I just ask you one final question, Liz, around cortisol and adrenaline, you know, the stress hormones and the impact they have on our lives when it comes to everything. Research on, you know, on the stress hormones, where would one access it, or how could one look at the impact of stress, let's say, on the body when it comes to, let's say, cancer?
It's really hard. We know that a little bit of stress is good for you. Mm-hmm. We know the fight or flight response, you need that to help you cope with very stressful situations to keep going. There are lots of people who have suggested that increased stress can cause cancer, but there are no studies that have proven that. And that, again, can make women feel guilty that because they got divorced or their son got ill, then it's therefore they got cancer. You can't say that. I tend to do a lot of my research on PubMed and Google Scholar, looking for academic articles, sorting by date. That's where I start. But YouTube is now one of the biggest search engines for health information. the general public will often go to YouTube and Instagram, and it's the people that have the biggest number of followers. So you may find an influencer with 2 million followers saying stress causes cancer, you need to go and live in a shed, and people believe it. And I think it's really hard for the general public to learn how to understand, is what they're reading true? Is it biased? Can I repeat it? Because they don't have the skills to critically research and evaluate literature. And again, you can find a paper in a journal saying stress causes cancer. But if you then look, and that's a journal in South Korea written by 20 people looking at 10 patients, that's not the same as a randomized controlled trial in the Lancet. And again, it's really hard to find that accurate information. Where do you go to find your research? Sorry, Breeda. Where do you go?
Let's say PubMed as well would be, and the Lancet, let's say reading the Lancet would be another good source of information. British Menopause Society as well. I'm always logging in there because I'm a member there.
Yeah, but I used to get patients. I'd get patients come with articles they'd seen in a local tabloid. Is this true? Can I have this? And what they do is take that one sentence that's a great headline and say, actually, that's not what it's saying. And it's really, you feel you're breaking people because they've come to you with hope.
And I think this is why it's so important that women like yourselves, your breast surgeon, Dr. O'Gorman, and Breeda, you're in the area of menopause, that you are now actively encouraging women to actually look at the research, but also self-manage your own health, your own midlife health, your breast health, taking personal responsibility for your health plan and your health care, as well as talking to the experts. I think that's really important, about talking to medically trained experts and experts who are trained in these areas and that do liaise and communicate with other medical experts, instead of just Googling and finding, as you said, an influencer who is not trained or does not have that backup of research or network of other medical professionals. The self-management is key.
Yeah, very true, Roisin. Yes, and I do a lot of work now in workplaces. I work with Henpicked. Liz, you may have heard of them in the UK, Henpicked Menopause in the Workplace. And what's wonderful to see is how workplaces are embracing the need for education in the workplace in order to help women to thrive, in these years. Far too many. I've heard, this is feedback now from different groups that I've worked with. We're saying that women are reluctant to go for promotion in their late 40s, early 50s. What is going on? These highly accomplished, experienced women. And it's when I talk about the confidence dip that often happens in perimenopause, but it's not permanent. It's something temporary when the hormones are there fluctuating. I experienced it myself a few years ago, but it's not temporary. Unfortunately, too many women feel that that they've lost a lot of their mojo and they won't go for promotion, or worse, they leave work. Unfortunately, that is happening, and
it's
we have
really
to
hard.
stop.
And I think for me, one of the hard things I found was I came out of chemo at 41 thinking, what do I wear? And we are now seeing so many cool women in their 50s and 60s wearing what they like and kind of finding their new fashion sense. But from a work point of view, firstly, it was chemo brain fog, but then the menopause. I couldn't remember two things at the same time. I used to be able to see a clinic full of women and sit down and write the notes at the end. Now I couldn't remember what my name was. And having to learn to think and work differently. And luckily, my colleagues gave me that extra time I needed to write the notes and do my job. And I think that can really change around the menopause when you forget the names for things. You're not as clued up as you were compared to the men you're working with. And how do you say, I'm still blooming good at my job, but I need an extra 10 or 15 minutes to make sure I do this properly. It's out of my control. This is what things are. And I think it's really hard to have those conversations without fear of being discriminated against.
Yes.
The good news is, in particular in the, sorry, Roisin, the good news is, particularly in the UK, more and more men are coming into the webinars actually, and line managers, CEOs, even in the last year, 50% of the rooms now, there are men actually sitting in, wanting the information, which is fantastic to see. So yeah, because we do need the men. in moving the conversation forward and getting the support. We need the men involved in this also.
We do.
And, you know, as well, we have male doctors, we have male GPs. And, you know, I was so blessed because I tell the story all the time. It was my own GP when I was 42. He noticed me in the supermarket. I put on weight. And that day morning, I put on my favorite outfit. And oh, God, I can't even get the zip up. So I went over, folded it over, and he says, Roisin, you put on weight. Coming to me tomorrow morning at 9:15. I want to do a blood test. And I went, well, I can't say how dare he because I've noticed it. I did the blood test and come back in a week later. Roisin, just as I thought, you're right smack bang in the middle of menopause. I says, Dr. Lynch, I think you've got the wrong file. Nope. You know, so, but I was lucky. I am lucky still. I have a really good GP. And, you know, and he's a male. And I think that's really important that, you know, we also respect that, you know, I know a lot of people say, oh, you can't have a man telling a woman about a woman's health. But sometimes men have a different perspective on a woman's health. And sometimes they're doctors as well. Doesn't matter about their gender if they're good or bad. You know, if they're good. Sorry, it does matter. It doesn't. The gender isn't a factor. They're doctors. They're professionals, and that's what matters. And as Breeda said, they're coming more and more in the workplace. And it's about the self-management part that an awful lot of women are just saying, oh, I'm going here, I'm going there, what do I do? And that's why your cafes are great, Breeda, at the education of women about what menopause, and you navigate them to different people. So the self-management, I think the media is focusing so badly and negatively towards the negative aspects. No one is saying self-manage, take responsibility. You know, as you say, Dr. Riordan, the HRT, it didn't suit me. You know, I tried it for two weeks during COVID. I was at menopause since 42. I told Breeda this, and then I still don't sleep. And so my doctor, because I had breast issues, I had a lot of cysts and clusters and everything else, and attended the Vincent's, and so I phoned him and said, I need HRT, because I was hearing about HRT. He said, Roisin, you know, your contraindicated, I'm not happy. And he says, well, why do you want it? I said, can't sleep. So he said, well, Roisin, natural doctor, you know, is there any other reason? Is there any particular reason you're not sleeping, like stress? I said, not getting enough sleep. And so he gave it to me. He said, I'll give it to you for 3 months. It was the patch, so it went through the skin. So I slept for two weeks, but on within the fourth week, I noticed I woke up at 2 o'clock in the morning, and the fluid and the inflammation in my hands and my feet, I couldn't even move. So I had to switch it off. So the HRT doesn't agree with every woman's body anyway.
No, it doesn't.
You know, and I think the self-management, the education, and celebrating menopause. We haven't got, you know, we should go back to the olden days where women used to celebrate menopause. Yes, like I had a horrendous menopause, but celebrating that there's light, as Breeda said to me, at the end of the tunnel. And, you know, looking after your breasts is very key part of menopause, and looking after your body. Awareness, education, and also camaraderie and women's friends is, and really getting out there and talking about menopause openly, and really finding that female friendship is really key, isn't it?
Yeah.
Yes. Yes, we're coming. I mean, when you talk about the education piece, the information piece, we're coming from a very low bar. You know, Ireland, I know we're following on from the UK, and we're actually way ahead of the US and Australia, South Africa at the minute when it comes to information. And the Irish government here have been fantastic in the last year. In 2022, they have opened up specific menopause medical clinics. They've also provided GP guidelines for all GPs here in Ireland, as well as funding an education and awareness campaign. And for me, I feel it's the education and awareness. It's getting everybody to talk about menopause, normalizing the actual conversation, that is where we need to go. And once women, you know, realize this is a kind of a part of life that everybody goes through, and once you have agency, or you know, you can manage it, you know how to manage it. And I'm coming from a place where, as a midwife and a community nurse, for years I've worked with women, and I mean, women do hard things all of the time. But what I couldn't understand was why was menopause so different? And what I discovered was that massive lack of education, and that massive information deficit, or no signposting, no preparation. That leaves too many women in crisis. And so,
Have we lost you, Breeda? I think
We might have.
lost her internet. But Dr. O'Riordan, you know, we talk about breast cancer, and you've had breast cancer yourself twice, and you know, there must be, and from your personal perspective and dealing with women who have breast cancer, life after breast cancer surgery can be an emotional roller coaster of ups and downs, and adjusting to the different body shape with maybe having the breast removed. You know,
Mm-hmm.
what was your experience, and what advice would you give women?
It's really hard. I had a mastectomy and implant reconstruction, and I felt guilty that I was doing it out of vanity, because I used to wear a lot of kind of deep V-neck dresses at work, and I thought, I can't change my wardrobe. Plus, I didn't have a lot of fat, and if I didn't have a reconstruction, I would never grow enough of a tummy to get enough skin to reshape a breast after radiotherapy. So I thought, I'm not burning any bridges. Radiotherapy ruined it, which can happen. So I had to go flat. And I remember the day before I went flat, walking around my local supermarket crying in tears. I had chronic pain on the chest wall, so wearing bras was painful. There were no bras in my size, because I was a 30D, and M&S and Debenhams didn't go down to that. They were all pink. They were all ugly, because they're full cut bras to get a prosthetic under. And I thought, I'm going to spend my life walking around like a hunchback in thick jumpers. I can't look at myself. I wouldn't let my husband look at me naked for 6 months, because I hated my ugly scar. But time is a great healer. And now I walk around with just one breast. And again, you could say I'm lucky because I'm relatively small chested, so it's not that obvious, but I don't care what I look like now. It's time. For some women, you don't know what your breasts mean to you until you're told you have to have one removed. And it's, how do they define your sexuality, your femininity? I had my breast removed, I lost my hair, I lost my ovaries, I lost my estrogen, I lost my libido, I can't flirt, I can't wear dresses. How can I still be an attractive woman? And you kind of realize it's inside me. I just need to find a new way of being like that. And I think there's no easy way to go through it. And whatever you're feeling is fine for you to feel it, but your family, your friends might not understand it. There are incredible women out there now who are showing what you can wear and how you can dress, and you just have to find your own way through. Breast surgeons do what they can to make you look as good as you did before you came in. We can't work miracles. Sometimes it goes wrong. You just have to muddle through and give yourself time and accept this is shit, but you have had breast cancer, and we're doing this to save your life, we hope. But it's not fair.
And Dr. Riordan, as a breast surgeon, we spoke off air, as a breast surgeon, how did you feel? And what did you do when you were given the diagnosis the first time, because you've had breast cancer twice?
Yeah.
The first time as a breast surgeon. You know.
I knew it was coming. So most women will have a mammogram or an ultrasound, and then a biopsy is taken, and then they come back to get the results of the biopsy to find out it's cancer. My mammogram was normal, but I had an ultrasound, and I looked at the screen and I saw a 3-centimeter cancer. I knew. I didn't need to wait for the biopsy. In that moment, I knew it's big. I'm young. I'll need chemo. I'll need a mastectomy. I had a good idea what my chance of being alive in 10 years was. I got to go and ring my mum and say, I'll be telling you I've got breast cancer in a week. And I kind of switched off. I still don't think I've had it twice. I think because I've looked after men and women who've died of breast cancer, I can't unsee that. And I'm scared of what might happen to me in the future. So it's like the patient Liz deals with the breast cancer and this side of Liz carries on. But it's nothing can prepare you for when you hear those words.
No, because
and this is where, sorry, Roisin, this is where, Liz, having someone like yourself, or Anise, another doctor that I follow as well, it's so wonderful having you there talk about it. It's like kind of, helping other women who, have been diagnosed or newly diagnosed get to grips with actually the overcoming part of it, which is very powerful.
Try not to be too scary or too pessimistic, and just trying to give the facts as sensibly and safely as you can, because there's some really, quite rightly, some quite emotional blogs that can be very scary to read if you are in the middle of treatment, you're just diagnosed. And it's just trying to find a little corner of the internet that might be a safe space for some person. And if I just help one person a day, then that's enough for me.
And Liz, you in 2018 you wrote a book. You published your book, A Complete Guide to Breast Cancer.
Yes.
And and Breeda also wrote her book. But tell us about your book and what inspired you to write the book, and what challenges, personal challenges, did you have in writing the book, if you had them, or did you compartmentalize them as doctor, and the patient?
So I started writing a blog, which got quite a lot of traction. And I realized, instead of writing like my PhD with sentences that have 500 words, I could write for the general public and explain medicine that way. And another doctor contacted me on Twitter to say she was having chemo at the same time. And that was Professor Trisha Greenhalgh, who I worshipped as the queen of evidence-based medicine. Her books got me through my surgical exams. That, oh my God, my Shiro is now messaging me, and we're both having chemo on a Friday. She's a professor, she's a GP, I'm a breast surgeon. We both bought 20 books to find out what it was like to be a patient. We had never been on forums, and we're shocked at the questions women were asking, like, is it safe to have sex after chemo, or will my husband's hair fall out? And does radiotherapy make me radioactive? Because I know you take in nothing that I tell you, because you're still going, I've got cancer. So we wrote that book to share our own experiences, because between us, we'd had every treatment, to say, this is what you need to know. Not just the surgery, but how you cope with the mental health and the diet and the exercise and relationships and telling your kids and what to do if it comes back. Just that one book with a load of questions you can go to your doctors and family and ask them. And it was really cathartic in a way, but we didn't know whether it would be successful. Would women buy it? But even now, we'd get lovely messages from people saying, thank you, this is my Bible. And now there are some more brilliant books out there, like Sarah Lianagay, who's done a Ticking Off Breast Cancer, books just to help women with the lists, with what they need to know, instead of scouring the internet.
And that's so vital, to hear from a breast surgeon the questions, the answers, and even that's part of self-management as well. You're giving the women, you're empowering women with tools and skills to self-manage, with a communication strategy to take to the medical professionals, also talk to the people around them.
And talk about things like sex and depression and anxiety, and get it out in the open. It's just empowering women.
Yeah. And that's what it's all about.
Roisin, did you see on the Irish Times weekend here in Ireland, Liz, it's like the Guardian, let's say, in the UK.
Yeah, no, I've written for it,
The front page had sex and menopause. I thought,
fantastic.
Wow, that is just, that's breaking down the taboo now. The front page, it's actually gone to the coverage, and a full supplement on women's health last weekend, which was just brilliant to see.
Fantastic.
And Liz, you also wrote for or write for the Daily Mail as well, and you published an article about how alcohol, that your time as a medical student, like many medical students might, out partying, celebrating, and about alcohol as well. So you write for media too.
Yes, so it kind of starts off with videos that I put out on Instagram and Twitter. I wanted to do some public health messages and just say, they are scary facts to hear, but we know that if you drink and you are living with obesity, you are increasing your risks of getting 7 or 13 types of cancer and potentially having a worse outcome. And it's a really hard message. And I drank a lot at university. I don't blame myself, because I didn't really know the risks back then. And if I did, I probably wouldn't have listened to myself when I was 20 as a medical student, because our culture was all around alcohol. Date, birthday, how do you celebrate when you come home from work? You've opened wine. And it was the 90s and the ladette culture. But I do think we need to start educating our children and teenagers to say, these are drugs, they do have problems in the future. You can make a choice to drink, but I want to know that you're aware of what you're doing.
And that brings me on to this question. How young should girls start checking their breasts and for breast cancer? I know everybody, I remember Kylie Minogue had breast cancer and that was a big thing. And
In
then
her
everybody
30s,
started
yeah.
checking, you know, the breasts, you know.
So here's a question. Do you check your breasts every month, Roisin?
No, my daughter always gives me off, and I go, "God, I wouldn't know what to feel." I do check, but I go, "Am I checking for the right thing?" So what I do is I check to make sure they're the same, and if there's any similarities or if there's anything different.
But it's not every month. What about you, Breeda? Do you check your breasts every month?
I occasionally check in the shower, but it's not religious. I'm not doing it specifically.
You see,
every month.
This is it. We're not taught how to do them at school,
Yes.
and a lot of influencer videos have you doing it standing up. It's wrong, which is why I've done a video of me showing you what to do and what to feel using car sponges and a lollipop. So there's a link on my YouTube channel where you can find that video saying this is how a breast surgeon examines breasts, how to use your hands, what to feel. Your breasts have probably finished developing or growing by the time you're 18 to 21. So I think at around 18, you should do it mid-cycle if you're premenopausal, because that's when your breasts are less lumpy. Put a reminder in your calendar. An alert picks up on your phone. Time to check the breast today. Then you'll know. And at the same time, we should check our pee and our poo. How often do you see whether there's blood in the toilet after you've had a poo? We just flush. So I try and tell people to do this because most of us don't shut the toilet lid when we flush. But germs can spray up to 6 foot in the air, and if you're standing over it. So look, put the lid down. We should be checking our pee, our poo, our moles, our urine, our breasts. It's a general all-over health check once a month because younger and younger people are getting cancer. And if you are not self-aware of your body, you might miss something.
Yes, and like checking your poo, it's not something I would ever, you know.
But look at Balbabe, the amazing Deborah James who died, and trying to get people, it can happen to people in their 30s and 40s. If you don't look, she won't know. You won't know. Do you check your moles after skin damage? Do you look inside your mouth? Do you get a mirror and check your vagina and your labia? Because girls are getting vagina and vulval cancer. And if you don't know what yours normally looks like, you won't know if there's a problem.
I think that's one of the great things menopause is bringing to the fore, and in particular here in Ireland, is like we do not talk about vaginas, vulvas, clitorises. Where
many women don't know what the right words for the bits of their anatomy are.
Yes, I don't.
But but it's fantastic. Yeah, this has opened up something. You know, it's really, and a lot of women have thanked me for bringing the conversation into groups. You know, because they've never taken a mirror and actually looked to see what actually, you know, what does my anatomy down there look like, which, you know, is very sad in many ways.
It's when you're comparing yourselves. If you look at your breasts, you just see like the topless model's breast. You don't know what normal breasts look like. And often our only frame of knowledge for comparing our own vulva is what you might have seen on a picture in a porn magazine years ago. They don't look like that. They age, they get lumpy, they're lopsided, they're long, they hang down. That's what is normal. But when you don't see pictures of what a normal vulva is, you think, oh my God, it's crazy. But Facebook has now freed the nipple. I think you are now finally allowed to post pictures of healthy female breasts without having them censored.
Yes, and especially when they're for medical reasons and, you know, women's health issues is really important. Yeah. So really from the age of, say, 18.
I would say about 18. Yeah.
And then mid-cycle and once
mid-cycle for life. And especially if you have a mammogram at 50, there are women who do get breast cancers that appear in that 2 or 3 year period.
Right.
A normal mammogram just means there isn't anything big enough to see at the moment, or there isn't anything there. So women will have their mammogram at 50 and not check their breasts until they're 53. But cancers can appear in that time. So this is something that you carry on doing. And if you're after the menopause, make it the first of the month. Again, alert in your calendar. Check your boobs, check your pee, check your poo. Done.
And check your down below. Name them names again. The vulva.
Check your vulva. Check your vulva with a mirror every once in a while. But every month you should check your breasts, your poo, and your urine for blood.
Right. every month. And so would there be with the blood and what would so you would look for blood in the poo? What would you look for in the urine? Blood as
The
well?
same, blood in the urine.
Wow.
So sometimes it can be because you've had a lot of beetroot to eat,
Yes.
but blood in the urine could be a sign of bladder or kidney cancer.
Yes. And blood in the bowels would mean bowel cancer. And
It could be a sign of bowel cancer. It could be a sign of inflammatory bowel disease. It could just be bleeding piles. But if it's new and it's there for a couple of weeks, you need to get it checked out because it might be cancer. And if you don't look, if you don't check your breast regularly, you don't know what's normal, you might miss something.
Yes. So check again from the age of 18, girls should be checking their breasts on a monthly, checking the poo and the pee, and put down the that is really key. I would never thought about that from 18. Would you, Breeda? Never in the life. But there again, I'm a lay person, and this is the messages we have to get out there to women to get back into self-managing. And
I think you're an adult, you're a grown up, you have to take responsibility for your body. And that means looking after it.
Yeah.
Eating a healthy, balanced diet, exercising it, drinking lots of water, using sunscreen, going for your screenings. It's all those healthy, sensible, boring things that aren't fun, but they're a part of being responsible for your body.
Exactly. Dr. O'Riordan, I don't want to keep you too long, but because Breeda and I really appreciate you coming on and to talk to us about this.
That's been
Because
great.
this is something we need to actually start talking about more often within society and culture and with our women friends. You know, another thing with breast cancer, you had to retire. And that was all another, when you think about you had breast cancer. You went straight into menopause. That was two shocks when you think about it in one. And then you had to retire. So, that they were three life-changing situations that happened at once. How did you cope with that?
You just do. It's really funny. I think having chemotherapy and cancer was really, really hard. Going back to work was really, really hard. Then it coming back and not being able to work was really, really hard. But you just have to cope. You find that inner strength from somewhere. And I think, this is completely anecdotal, but for patients who think it's the end of the world, they never do quite as well as people who think, well, okay, this has happened, but I'm not going to let it define me. I wanted to find out who Liz was, not Liz the cancer patient or Liz the breast surgeon. I finally had that chance to say, right, I've got the rest of my life to work out what makes me happy. What do I want to do? I don't want to be known as the breast cancer patient. I don't want my gravestone to say she was a breast cancer patient or a breast surgeon. I want to be Liz. And it's given me that energy to explore that and to re-identify myself. But it is blooming hard. There are many, many bad days of crying, anger. It's just horrible. But you just have to get through it. I think it's almost harder for my husband, who had to watch me feeling impotent from the sidelines because he couldn't make me better. And I think family and friends watching someone go through a terrible life stress also need the cards and the love and the support, because they do feel helpless and you might not want to talk to them. But you just find this inner strength. You say, right, today's another day. Who am I? What am I going to do today to make me smile?
I like that. What am I going to do today to make me smile? And it's about the mindset, isn't it? And reconnecting to who you are and building that relationship with yourself. Because many of us know we can't have relationships with other people until we have one with ourselves and we know who we are.
Yeah, exactly. You have to accept what's happened to you to find a way to move on. And I think that's really hard for women to do because we compare ourselves to these ridiculously imperfect ideals on the internet, and no one looks like that or lives their life like that without a lot of help in the background.
Dr. Roisin, we mentioned you've written your book. And you have your YouTube channels, which we'll put all the links to down below, and especially the one with the breast check as well, and to your book. You also are publicizing your memoirs in March.
Yes, I am. I started writing about my life as a female surgeon during COVID, and it grew and grew, and it's going to come out. So July the 6th, it's called Under the Knife, Life Lessons from the Operating Theatre, that you can pre-order it now. It's my story as a female surgeon in a man's world. There aren't any books written out there telling the story of a female surgeon. We've got Adam Kay and the amazing book by Paul Kalanithi, but it's how you find your feet when you're having harassment and bullying and dealing with the joys and the pain and the laughter of learning how to operate, and the actual craft of what does it take to operate and to tell someone they've got cancer. I then talk about the depression I experienced twice as a consultant surgeon, dealing with the stress of telling 10 women a day they had cancer, because I don't think the public understand. We don't get coaching, we don't get counselling, it's just part of the job. And then getting breast cancer myself. So it's really hard to put into a pigeonhole. It's kind of like a medical memoir with a bit of mental health and a bit of cancer and a bit of you can keep going when life throws you setbacks.
And it's really, what I'm hearing is you're actually telling women, don't get so bogged down by the trauma and the negative emotion, that it's up to us, like self-managing our health, it's up to us individually to dig deep down within ourselves to find that inner strength and that self-confidence to say, I don't know what I'm doing right now, but I know I'm getting through the day.
And it's a bit like learn from the mistakes I made and recognize you will make them. You will do the wrong thing, but that's life. You pick yourself up and you move on. So, Breeda, you were going to ask me a question. You look like you were.
Yes. Well, first of all, I'm definitely buying your memoirs to read. But as you were speaking there, I was just thinking, because both Roisin and I, we have daughters who are in the medical profession. But when it comes to, let's say, patient advocacy is huge here in Ireland. But there hasn't been that shift to, looking after the doctor, the nurse, the frontline worker first. And that shift needs to actually occur. And I think you beautifully articulated, what, and I think your memoirs are going to really help in I think society and also health, the NHS and the health boards here to understand we have to look after the frontline workers. And
I think people think we're robots.
Yes.
We're not allowed to make a mistake. We're not allowed to have a break. We're not allowed to do this. We have to be perfect. But we have stuff going on in our own lives that you have to put a lid on. You're going through divorce, your child has cancer, but no, you come into work, you see your patients. We need help to deal with everything that life throws at us. And I think, especially off the back of COVID, we're realizing that doctors get burnt out, and we need to look after doctors and nurses and everyone else just as much as we look after the patients.
Yes, and that
thank you for saying that.
Yeah, that conversation needs to open up big time, I think, here as well in Ireland. But talking about the transformation there with, you're looking to find Liz and who the real Liz is during all of the treatment. But that actually happens with women going through natural menopause as well.
Yes.
It's this kind of an awakener. If we
a chance to start again.
And if we're not in denial, I meet so many women who do not want to hear the word menopause. They are in massive denial. They don't want to go there. But you have to actually embrace all the shite that goes with the symptoms to actually come to a place of realizing, that there's actually more to me than just a mother. That's I have 4 kids, as well. But there's more to me than being a nurse, a midwife, a coach, an educator. And that was a big, big learning for me in the last few years. And again, it's the positives, I think, of this, because there's so much negativity and because of the negativity bias that we're all kind of drawn to, it's so important to start popping in that, highlighting the fact that there are positives as well as we move through our middle years.
Yes. So this reminds me to an episode of Fleabag, where Kristen Scott Thomas plays the business leader who says, yes, the menopause is shite, but then it's glorious. All the pain has left your body. And I thought, we need more of this. It's a couple of years of getting through and then you're free.
Yes. I'm out there now. I think I've got over the bridge. I'm on the other side. But it's head-wrecking when you're going through it if you don't understand what's happening.
And everyone is telling you, you need to buy menopause skincare and menopause creams and menopause teas, and everyone's saying it's awful. We need to get the voices of women saying, it's a bit shit, but I'm fine now. It is a normal something that's going to happen to you, and let's help you through it rather than, oh my God, it's that whole, can we get over the menopause and just make it a natural part of life that we educate and help women through?
Here. Yeah, I'm all for that. Liz, what is the name of your YouTube channel? Is it Liz O Riordan?
It's Dr. Liz O Riordan.
Okay, lovely. I'll definitely have a peep.
I'm slowly
Uh,
moving all my Instagram content onto YouTube. I've now got 5 channels and it's just me doing it. So, but yeah, they will all be there. You can also find my videos on my website, liz.oriordan.co.uk as well. So
okay,
And
lovely,
you're
lovely.
very
get in
active
touch.
on Twitter as well.
I am.
Yeah,
Well, it's kind of my kind of job now. It's
Yeah.
kind of how it doesn't pay for anything, but it's nice to know that you can educate and make contact with people and
And you're
make a
absolutely.
difference.
empowering women. You're empowering
Yeah.
women. And
Yeah,
this is what we need, I think, and Breeda and I have often talked about this, it's us women now at our age. We need to help and we need to be
We
there
do.
and mentor and show the younger women, don't get caught up in the media negative
No.
narratives. Or,
yeah,
you know, we need to say, wow, you know, all this negativity about menopause and about even about breast life after breast surgery, that you know what, women have gone there before us, and this is 2,000 years, and
Yeah.
women have gone there before us, and they got through it, and so we
Breeda, I can
do
see
that
you've got your
tonight.
book there. Tell us about it.
yeah. You see, we are a new generation. That's why I wrote the book. We're a new generation of women, and that's why we do need to talk. I'm perplexed still at the amount of silence. The fact that women have stayed quiet for so long around menopause. That's really perplexing. But every conversation, there's this massive ripple effect that I've seen in the last 4 to 5 years.
Yeah.
Every conversation counts. And I wrote the book. I published it last year, and I put this brain with puzzle pieces because I really feel we do not have all the pieces yet to what the transition is really all about. So, but we're getting there, and
We are.
getting the governments involved, getting women, getting the whole of society, workplaces is really shifting. The taboo and breaking down barriers to us in our middle years.
Dr.
Yeah,
Roisin and
take
Breeda
care. I gotta
Birmingham,
go,
thank
guys.
you so
Bye,
much
Roisin.
indeed for
You're
joining the
welcome.
Confident Women Island chat today.